For my scenario, I am responding to 19365 Cypress Ridge Terrace for altered mental status. Arrive on scene, scene safe, BSI. I have one patient. I'm here for altered mental status, so I see that the one patient has an altered mental status and is agitated. They don't know where they're at. How you doing today, sir? My name is Taylor. I'm with the fire department. I see when I walk in that the person looks at me, so they're alert. What seems to be the problem? They tell me that they're agitated and have an altered mental status, so their airway is open and patent. They're breathing about 20 times per minute. I'm going to feel for a pulse. Pulse is present and skin is warm and flush. The instructor lets me know that the patient is breathing 20 times per minute. Radial pulse is rapid, strong, and regular. And sir, do you know where you're at right now? Okay. Do you know your name? Do you know what the month is? And do you know who the president is? Patient could only respond to 2 questions, so they're ANO times 2. I'm going to have my partner take a set of vitals, start with a BGL with altered mental status and agitation. Sir, are you diabetic by chance? Patient does not respond. They're still agitated. Partner checks for SpO2 and blood glucose level. First set of vitals with the BGL states that it's 42 and SpO2 is 96% on room air. So I will not give him any oxygen since he's 96%. Altered mental status, BGL being 42%. I'm going to take out some oral glucose and do my 6 rights. Make sure it's the right medication, oral glucose. It's a right dose. It's 1 tube that I'm going to start off with to give the patient. It's not prescribed to him, so I don't need to see if his name's on there. Do need to see if it's expired. It is not expired. Need the right time, which it is 14:12, and then document contraindications. Patient must be able to not choke on it and be alert. And patient is alert, and I instruct them that, sir, I'm going to give you oral glucose. You're going to squeeze the tube into your mouth and swallow it, or you can hold it buccally on the side of your cheek. So I give it to the patient understands. Partner's taking a blood pressure. I got respirations 20 times a minute. I got SpO2 and oscillate his breath sounds. First set of vitals were 20 unlabored, lung sounds clear, blood pressure 134/80. His pulse was 96, weak and regular. Skin was pale, cool, and moist. For his pupils are pearl. Again, that blood glucose was 42, and his temp was 96.7. Sir, do you have any allergies? Do you take any medications? Do you have any past medical history? When's the last time you ate or drank something that maybe your blood sugar was low? And what were you doing before you started having an altered mental status, feeling weak, a little dizzy? And give the patient the medication. Now I'll do, since the patient is altered mental status, this will be a load and go. I'll request ALS. C-spine is not needed since he did not fall, and I'll move him to the ambulance. Recess his vitals every 5 minutes. Now I'll check his BGL again after waiting 5 minutes of the oral glucose to see if that helped. And take another set of vitals, blood pressure, respirations, SpO2, pulse, lung sounds, and temperature. Second set of vitals after oral glucose, 20 breaths per minute unlabored. Breath sounds clear, or lung sounds clear, 130/78, pulse 88, strong and regular. His skin is now normal, warm and dry, pearl. He dropped down to 94% on room air, and he is at 97.5. So his blood glucose level is getting better. Again, we're in the ambulance. We're going to the hospital, requesting ALS or get to the hospital. Main thing is to get his blood glucose level up, reassess his mental status, his AVPU alert, verbal, painful, or unresponsive. Sir, do you know where you're at right now? You're in the back of the ambulance? Yes, sir. Yes, sir. We're going to the hospital to have them check you out. What's your name? And what is the month? And the patient was able to respond to all 4 questions, so he's A&O times 4 now. And after my second set of vitals and reassessing every 5 minutes, I will give my radio report to the hospital and tell them we're en route, my ETA, and that I have 1 patient, male, 32 years old, altered mental status, blood glucose level was low. We gave him 1 tube of oral glucose, and that his glucose level came up afterwards, and his vitals for lung sounds, SpO2 and his pulse and blood pressure, and that will be 2 minutes out. Thank you.